Hi, everyone, and welcome to the webinar. We're just waiting a few minutes for everyone to join. Okay, hi everyone. We'll just do a quick icebreaker as usual. Just drop your name in the chat, university and year of study, or if you're a trainee, say foundation training year, and then where you're doing your training. And then we'll start in a few minutes. Lovely, thank you guys. We've got trainees, we've got fourth year, we've got second, third year. That's great stuff. Okay, we've got quite a few people join now, so we'll make a start and then everyone else can join afterwards. So hi everyone, for those that don't know me, I'm Emma and I'm the BPSA competitions coordinator, and we're running that webinar tonight in collaboration with Pre Reg Shortcuts, and that's on clinical and OTC. And we've got Marvin and Georgina joining us from Pre Reg Shortcuts and running that webinar. So I would like to thank them first for their time and joining us, and I'll let them introduce themselves. So if we start with Marvin.
Hello, everybody. Hello. Please type 1 in the comments if you can hear me, and if you can see me clearly, type a 1. Thank you very much. I'll just introduce myself. Very excited to be here. Thank you, BPSA, for giving us this opportunity. My name is Marvin Munzu. I'm a community pharmacy manager, superintendent pharmacist, BBC featured media pharmacist, author of the book Success Secrets for Students, personal trainer, Jake Mann's media expert, international keynote speaker, managing director of Pre Reg Shortcuts. In terms of my personal awards, I received an award as the Community Pharmacy Manager of the Year. I was nominated by the CND, Chemist and Druggist, as one of the top most influential pharmacists. And last year, I also was the finalist for the award for the Above and Beyond individual. In terms of my personal activities, I'm a UK natural bodybuilding champion, and I'm very excited to share with you knowledge today that's going to help you to succeed on your journey as pharmacists. So that's it for myself. I'll pass it on to my colleague, Georgina.
Hello, everybody. Can you all give me a 2 if you can hear and see me, guys? Give me a 2 if you can hear and see me. Fantastic. And if you were here last week, hello again. I'll introduce myself again, but if you wasn't here last week, don't worry, I will bore you with everything about me. Don't worry. So about me. So I'm a pharmacist for community background, and I specialize in anticoagulation, where I was the only provider of anticoagulation clinics in my working area. I also implemented the GPhC, PCS and hypertension case finding service across Kent. So I trained all 326 pharmacies across Kent and Medway, and the same thing with hypertension case finding service as well. I have a special interest in mental health. So during my pre-reg year, what I done is that I created a COVID-19 mental health awareness service, because when I was a pre-reg, COVID was rife. So I created a COVID-19 mental health awareness service. In terms of my personal awards, so back in November 2021, I won a C&D award of the category of pre-reg or provisionally registered pharmacist of the year. I also won an award from my university for the best academic performance on the MPharm degree program. And of course, something that I still don't know how I've done to this day is that I still don't know to this day how I got 100% in counts in the GPhC exam and 98% in clinical. I don't know how I've done it, but I've done it. Okay, so I am so excited to be teaching you guys again this week, but instead of boring MEP, because pharmacy law can be a little bit boring, we're going to be going through OTC. That's way later on in the session.
Wow, great introductions. Thank you, everybody. So has anyone been to any of my sessions before? Has anyone attended any of my sessions, watched any videos? If you have, type a yes in the comments. If you haven't, then type a no. Welcome, all of you. Welcome, everyone. Disha in the house, Maria, Osiria, Gulsomeda, and for the course, Avnit, Kamini. So I'm getting loads and loads of yeses. Oh, there's a no. Eleni, no. Welcome, Eleni, to the session. You've never been to one of my sessions, the full of energy, passion, knowledge, engagement. So here's what we've got for you today. Welcome to Pre Reg Shortcuts. Today's agenda, we're going to start from 7, well, slightly later. But I'm going to focus on the cardiovascular system today. How many of you are sitting the exam in June? If you are sitting the exam, type on me. Type on me in the comments if you are. Nicole, Bev, Golsam, Eleni, Hannin. Wow, all of you will be amazed because we have great questions today that are reflective of the GPS exam. And then I'll also give you my prediction. Every single year, I do a prediction and always comes up in the exam. So we're going to have a prediction. Some of you on the combo course, you would have seen some of these predictions before. So between 8:15 to 8:50, we're going to focus on the OTC with the lovely Georgina in the house. And then between 8:50 to 9 o'clock, I'm going to give you guys some tips. How many of you like to get some tips to help you pass your exam, your GPhC exam or your university exams? Give me a me, type of me in the comments. Great stuff. So I'm going to give you some tips today. And then also we will have 2 lucky winners today. 2 of you are going to win a place onto our foundation training program, our combo course. Is there anyone on here that is on our combo course? Is there anyone? Go someone, I know you're on there. Can you just put on one comment how you are finding the course? If you win the sessions today, if you win the course place, you will be the luckiest and the happiest person in the world. I promise you. So, hey, so what you need to do today in order to win these places, who wants to win a place today? Type a 1, type a 1, type a 1. If you want to win a place, you have to do one thing. You have to interact. The most engaging, the most interactive trainee, student, pharmacy trainee on here today will receive a place, a free place on our combo course program. But you need to interact, you need to type in the comments, and you will get the award. So I'm going to finish at 9 o'clock. So hopefully you will enjoy the session. So can you guys still see the slides? I'm going to go through 2 things. So for those of you doing the exam, I'm going to give you tips that are going to help you to absolutely, totally crush the GPhC exam. Now, if you want me to give you 2 ways to pass your clinical, type a 3. Type a 3 in the comments. Type 3 in the comments. So I've been doing this for so many years, and I've helped so many trainees succeed. Now, you've got 2 types of questions that come in your exam. And I'm not talking about the single best answered questions or extended matching questions. There are 2 types of questions. If you master these 2 types of questions, I promise you 100% you will nail the GPhC exam. So the first type of questions are what we call recall questions, okay, RQ. These questions are easier than the second questions. It's really about memorizing and writing things down. So things like perhaps side effects of drugs. How many of you have read the BNF, or you've done some studying, you've learned the stuff, but you are still struggling with GPhC style questions? Give me a me, give me a me, give me a me. Loads of us. Now, that's the first step. You could have recall questions, you could understand stuff, and you could be able to recall information, but that doesn't guarantee you passing or answering the second type of questions. So the second type of questions are the questions that many students, trainees find more challenging. So these are what we call analysis questions. So the AQ questions, these require critical thinking, these require analysis, these require application. Now, listen to me carefully and write this down. I hope all of you have got a pen and paper next to you. Today, I'm going to show you how to answer the first type of questions and the second type of questions. I'm going to teach you how to think critically, how to apply the knowledge that you learn in order to smash any GPhC clinical question in the exam. How many of you are going to love that today? If you're going to love that, give me one, give me one, give me one. If you want me to share with you my secret sauce that I've used all these years to help a lot of trainees. So that's what we're going to do today. I'm going to give you guys a secret sauce, and I promise you, if you apply this on any clinical question at university, the GPhC exam, you will totally crush it. So let's look at all these different types. So the first thing I want you guys to write down is a formula. Formula 1, your mnemonics. Anyone that's on my course knows we use so many mnemonics to help your memory. So the first thing you want to write down in order to answer GPhC style questions, clinical questions, I want you to write this down, DISCO. So type in the comments, DISCO, D-I-S-C-O, D-I-S-C-O. Right? Type, yes. Thank you, Jennifer, Maria. You will learn so much today. This is the best place to be. So we've got DISCO. What does that stand for? D is for drug. So any question, this is the formula that you use to analyze or to break down any question on critical analysis. So number 2 questions, okay? So the first D is for drugs, I is for issues, S for subjects. So it could be a male, female, pregnant lady, or child. C is for condition, and O is for other. So others could be maybe some blood tests. So if you have, I've worked with so many trainees, I've diagnosed this exam, I understand this exam. If you analyze all GPhC questions, all of them, right, you're going to have your clinical questions. There's going to be some drugs to look at. There'll be an issue with the patient. There's going to be a subject. That subject could be male, female, child, elderly. There's going to be a condition they're going to want you to know. And then finally, you may have other things in the question, such as blood or test results. How many of you have seen this already in GPhC questions? Type of 1, type of 1, type of 1. Today, ladies and gents, you're going to see a different style of learning. It's engaging, it's fun, and I promise you walk out this place and you will hear things you've never heard before. So the first thing is learn DISCO. Type DISCO, everyone. Let me make sure you remember this stuff. This is the key to analyze GPhC style questions. And then what we're going to do is I'm going to give you a set of questions, and then we're going to apply this in the question so that you see exactly how this works. So that's the first part. Number 2, the second mnemonic I want you guys to write down is GPS. You guys type GPS, ladies and gents, please type in GPS. 190 of us in here, the BPSA. Let's roll out with the energy. So GPS, what does it stand for? So this is the formula that you use in order to choose the right answer in the GPhC exam. How many of you, just give me a yes right now, struggle because when you see questions, you get stuck between 2 answers. So generally you get A, B, C, D, and E, but most of the time you could probably eliminate A, that's wrong, C is wrong, B is wrong, but then you're stuck on those last 2, like, oh my gosh, which one is it? So today is the day where you're going to put a smile on your face. Because this is where GPS comes in. GPS helps you to navigate. So just think about it as a GPS, your navigator. This is what you use to navigate your options in order to choose the right answer. So in order to be good, you need to know 3 things. GPS, the first G stands for your guidelines. So you need to know your guidelines, your NICE guidelines, your BNF. You need to know those guidelines. The second thing is your P is prioritization, which is the first line. What is the priority in the question? And then the last part is S, which is safety. Everything you do and all the options you give have to be safe in the GPhC exam. They don't try to check if you're an expert. They're not trying to test you as if you're a doctor. All they want to make sure is that Bahare, Mia, Hanin, Leah, all they want to make sure is that you can practice safely as the pharmacist. Okay, so these are the 2 things. Remember, what are the 2 mnemonics, guys? Type it down. Let me see. Let me make sure you guys are with me, because this is exactly what we're going to use. If there are 2 things you take away from today, if you don't take anything away, make sure you take this down. So DISCO, GP's DISCO is fantastic. Now let's combine these 2 together. What do we get? We get GP's DISCO. right? So GPs dancing, right? Just think about disco GPs. Are we good so far? Give me a yes if that is good so far. Give me a boom. Yes, why not a boom? Type of boom, ladies and gents. Type of boom in the comments. Yes. So we are good. We are good. Are we ready for questions? Give me a 1 if you are ready now. We're going to apply the stuff I just showed you. And remember, ladies and gents, I promise you, it doesn't matter what question, right? In the GPS exam, whatever question comes up, you will smash it with this formula. So, but before we jump in, we're going to focus on the cardiovascular system. Right? We could cover all chapters, but we cannot do this in the time we have. So today I'm going to focus on the cardiovascular system, and I'm going to show you guys exactly how to become the best at the cardiovascular system questions. How many of you like that? Type of me, type of me, type of me. Great, I love the energy. So here's what we have, predictions. I've always done this every GPS exam. All you have to do is analyze, and you could test what I'm saying to you right now. Look at some past papers, go through the questions. There are 6 key areas on the cardiovascular system where you get the most questions, right? This is a fact. So what are the 6 key areas? Use the mnemonic HAS. You guys type a HAS in the comments and make sure you're seeing that. 2 H's, 2 A's, and 2 S. Those are in the combo course, you know what I'm talking about. So the first H is for hypertension, the second is for heart failure, first A for anticoagulants, next A for arrhythmias, S for stroke, and S for statins. What does this mean and why is this important? Majority of your questions will come from the HAS formula. Majority of them. Okay, so once you master this stuff, you understand your hypertension properly, you understand those guidelines with heart failure, anticoagulants, arrhythmias, stroke, and statins, you are ready to smash cardiovascular questions. So 3 mnemonics today. We got HAS, we got GPS, and we have a disco. So disco time. Are we ready? Are we ready? Give me a yes. Give me a yes. We're going to start our questions, GPhC style questions under exam conditions. Here is the first thing, rules of the game. You must follow the rules. You must follow the rules. So for each question, you have to give the most appropriate option. In this exam, there may be more than 1 or 2 plausible answers. So there may be a second answer that is correct in practice, but in your exam, they want you to give the best answer, the best option. Second thing is you cannot use a calculator, ladies and gents. There's going to be 1 calculation question at the end if we get to it, just to test you. But you cannot use a calculator. Next thing I want you guys to know rules of the game, put on your pharmacist hats, right? From today, you're no longer trainees, you're no longer students for this session, you are pharmacists. Can someone type in pharmacist in the comments? Today, you are a pharmacist. For the next hour, I want you to answer these questions as a pharmacist, not a trainee, not a security guard, not a driver. You are a pharmacist. Okay, and that's exactly what the GPhC wants. They want you to answer questions as pharmacists. Okay, the final thing I'm going to say, because I know there's some of you that are excited. There's some of you are your trainee pharmacists here. You're more experienced. You're probably more knowledgeable, and then those are in the first year, or those are in the second year, or those are in the third year. Because we have a variation, please do not put down your answer until I say go. Okay. Do not put any answers down. You have 1 minute to do the question. Do not put any answer down, please, in the comments. I beg you, until I say go. Anyone who doesn't follow the rules has automatically been kicked out of the raffle at the end. Are we ready, BPSA? Give me a yes, give me a yes. Are we ready? It is showtime. Question number 1, 1 minute, let's go. Remember, no answers in the comment, no answers until I ask you to give me the answers. So when I say go, then you can give me the answers. No answers. Take your time. You got 1 minute. Smash it. All right, let's go, ladies and gents. Let's go. Let's go. I'm getting B's, E's, B's, B's, E, B, A, B. Wow, Aliyah, Fiona. Wow, lots of E's and lots of A's. A's or E's, A's or E's. So let's use our formula and let's see what the right answer is. Let's see what the right answer is. Let's use the formula. Let's start off with DISCO. You always start the question with DISCO. Are there any drugs involved in the question? Are there any drugs? You will see this in GPhC exams. Start with the drugs. Give me a yes if you can see some drugs in there. And what information does that give you? We've got metformin. We've got glycoside. What does that tell us about this patient? The patient is diabetic. Fantastic. Use D. We've got diabetes. Okay. Can we say any issues there? The patient has got hypertension. You guys see that? The patient's got hypertension. The question, we're trying to manage the hypertension. What about an S? Can you guys see any S's in them? So we've got our drugs. We're looking for an S. We're looking for any condition. So S is a male. Fantastic. But is there something else that you have? Remember, S is for the subject, African Caribbean. Thank you. Keywords. Right? So African Caribbean male, 32 years old, important. Highlight that part when you're doing your questions. Okay, so what about C, the condition? This patient's got hypertension and all other. So we can leave that out. So here's the thing, ladies and gents. Now we need to move to GPS. We've done the first part, the DISCO. Let's go to GPS. We need to know our guidelines. What does the guideline tell us with these patients? What is going to be the first line? What do you guys say? Is it going to be A, or is it going to be B, or is it going to be D, or is it going to be E? So calcium channel blockers, thank you very much. Anyone that put that down, because you've highlighted the subject, African Caribbean. Fantastic. So a calcium channel blocker is going to be the first line. However, according to your guidelines, it's not going to be a calcium channel blocker. What is it going to be? Because this patient has diabetes or is diabetic, we're going to go the other way. So it's either going to be an ACE or it's going to be an ARB as first line. Is this making sense? Give me one, give me one, give me one, give me one. Because the patient is diabetic, we've assessed DISCO. This patient is diabetic. We're not going to give them a calcium channel blocker. We're going to either give them an ACE or an ARB. Now we're down to this challenge that you will have in your exam. Which is the right answer? We know it's going to be an ACE or it's going to be an ARB. We can eliminate all the other ones, but we're now stuck with two options. This is very common. We have to apply our GPS. So we've done the guidelines. The second part of the GPS is the P, which is your priority, your first line. What does the guideline say? What is the priority? If an African Caribbean has ramipril or losartan, an ACE or an ARB, what do we give them? An ARB, fantastic. So according to your guidelines, first line prioritization, it is an ARB, it is safer. So that is the option. So GPS, guidelines, priority, safety. Great stuff. Is that clear? So your answer is E, type an E, type an E. Fantastic. Those that got E, well done. So this is an example. This is an example of number 2 type question, analysis question. Did you guys see how we use the formula? Did you see how we use the formula? Give me one, give me one, give me one. Right, great stuff. So this is an analysis question. Coming up, I'm going to show you the other one, which is an easier one, which is just a recall question. Okay, you're going to have both in your exam. So let's go to the next question. Are we ready for question number 2? So that's the answer and that's your rationale. So question number 2. Remember, no answers until I ask you to. Someone's asking, what was the last question? Answer, it was E, it's an ARB. So you either, if the patient is diabetic, you give them an ACE or an ARB as a first line for nephroprotection. If that patient's an African Caribbean, only if they're African Caribbean, then an ARB is preferred over an ACE. Okay, if that was a Caucasian, we'll probably give an ACE. But if it was an African Caribbean and you had to choose between an ACE or an ARB according to guidelines, you go for an ARB. Okay, so what's the answer to this question? Let's go, ladies and gents, let's go. I'm getting A, I'm getting B, I'm getting B, I'm getting A, I'm getting B, I'm getting A, I'm getting B. Fantastic, I'm getting a mixture of A and B. And this is what I want to teach you guys today. I want to get you to be the best. I want you to be the best. And I want to show you how to reason, how to use analysis, okay? Now, this is the thing you need to realize. If you go through every GPhC exam, there is always feedback at the end of the exam, which is posted on the GPhC website. Has anyone seen that feedback before? Give me a yes if you have. So the GPhC is going to write down the questions which many students normally struggle with the most. So if you're doing the exam in June, ladies and gents, take note of this specific question. The questions where students struggle the most are questions that require referral. Okay, referral questions. Again, it's coming down to prioritization. So let's use our formula. What's our formula, ladies and gents? What is our formula? What is our formula? What is the formula? What are we going to use? We're going to start off with our disco, and we'll look at the patient. What do you have as S as a patient? Well, let's start with D. D, any drugs? Yes, ramipril, blood pressure drugs. Fantastic. We can see atenolol, and there is warfarin. Highlight this, red flags, okay? These are your drugs. What about any issues? What has this patient got? This patient's got fungal infection. Okay, any conditions, most likely going to be some sort of blood pressure. Okay, are you guys with me? Give me one, give me one. I've got the patient is diabetic. Does this say it's diabetic? I don't think so. I cannot see that anywhere. I cannot see anywhere that this patient is diabetic. So there's nothing that says the patient is diabetic. Okay, great stuff. So let's look at this question. So remember when I said to you guys, some of you will be stuck between A or B. This is going to happen in the exam. You're going to go, all right, I'm going to eliminate this, I'm going to eliminate this, but I'm stuck with two answers. The reason why you get stuck is what I said at the beginning. In your GPhC framework, the GPhC states very clearly that there will be some questions where you have more than one plausible answer. And what this means is you may have more than one correct answer in practice, but in the exam, there is only one best answer. So let's look at how we decide. So after we've used disco, what's the next thing we use, ladies and gents? What formula do we use after disco? GPS, fantastic. So let's look at our guidelines. Let's look at our guidelines and let's look at our priority. All right. So sell the patient clotrimazole as it does not interact with warfarin. Who is going to sell? Who's going to go for A type and A if you're going for A? Who's going to go for B? Type of B if you're going to go for B. So you provide advice only, and then you will refer the patient to the GP. So just to make it easy for you guys, C, D, and E are wrong. Okay, I'll make it quickly. So sell alternative antifungal because clotrimazole increases warfarin concentration. That's not correct, right? Provide lifestyle advice. Advise her to check her iron out first. It doesn't solve the problem. It doesn't solve the problem. So your answers have to help with the solution, okay? So providing lifestyle advice doesn't change the fact that this patient has a fungal infection to deal with. So advise her that the fungal infections are self-limiting. This is completely false. So we're left with A and B. So you have to decide between these two. Let's prioritize this question. So remember, your option has to be the priority. Number two, it has to be safe, okay, and within your scope of practice. So sell clotrimazole or provide advice only. Now, these two answers in practice, they are plausible. So Andy, Safa, Maria, if this patient walked into your pharmacy and you gave the patient advice and you referred them to the GP, it's correct, right? You haven't killed them. You have given them advice. Plus, in terms of safety, you've referred them to the GP. So it is a plausible option that is not going to get you onto the GPhC records, all right? No fitness to practice situation. But is this the best option? Who thinks it is? Type a yes. Who thinks it's not? Type a no. So it is plausible, but no, it is not the best option. Why? Your most appropriate option when you look at it is A. Sell them clotrimazole because there isn't any interaction between clotrimazole and warfarin. There isn't any interaction. In your GPhC, in your BNF, there's an MHR warning, which has come up in the exam with warfarin and miconazole, okay? Dactarin oral gel, but not clotrimazole. There's an interaction with fluconazole, but not clotrimazole. So there isn't any interaction between clotrimazole and warfarin. So there isn't any reason why this patient should be referred to the GP. Okay. And yes, it's on our foot as well. So if you refer the patient to GP, it is not wrong for the patient, but it's not the most appropriate action. Does that make sense? Type of 1, type of 1, type of 1. So this is where people get things wrong. And what the GPhC is trying to do is trying to stop many pharmacists from going for the second option. So we need to think more. It used to be easy back in the days to just refer them to A&E, go to A&E, go to A&E, go to your doctor. But now the GPhC is testing you to make sure that you can actually deal with ailments in the pharmacy. Okay, so someone says, but they are not diabetic, so it's not a referral anyway. Exactly. We don't have to refer this patient. There is nothing in the question that requires a referral. Okay, someone is saying if it was flushed due to age, yes. Okay, so if it was flushed, then that age you probably you definitely refer them. But in this case, no. Okay, are we together? Give me one, give me one, give me one. Let's go to the next question. Let's get to the next question. Great stuff. So next question. So that's the answer. No interaction. These questions come up a lot in the GPhC exam. In almost every exam, you're going to get a question where a POM med interacts with a P or a GSL medication. In every exam, you're going to get a question where a POM, prescription only medication, interacts with either a P or a GSL drug, right? So in the past, they've given a lot about warfarin and miconazole, so you may get one of these questions. So learn this stuff on the combo course. All of you know what this is all about. All right, next question. So this question is an example of the first type of question. It is a recall question, okay? It is a recall question. This is a recall question. So what's your answer? Let's go, ladies and gents. What your answers? Fantastic. Well done. You guys are all following the rules. I'm very impressed. There's 213 of us, and you're all following the rules. That's very impressive. You all do so well in your uni exams and in your pre-reg exam. Loads of D's. Everyone's giving a D. Why is everyone giving a D? Because these are the easier questions to get. What condition is this, ladies and gents? What is this? Angioedema, Mihal, thank you very much. Thank you very much, angioedema. So do you guys see the difference between a content recall question and an analysis type question? Give me a 1 if you do, give me 1, give me 1. So with these sort of questions in your exam, you're going to have a mixture of both. Many students are going to thrive on these type of questions because it's literally memorizing and literally spitting the information out. But the one where you're going to have the challenge is number 2, analysis. But we have our formula, don't we? Do we have our formula? Give me yes, give me yes. So we're not going to struggle with any of these questions. Okay, next question. So the answer is D, angioedema. Well done to all of you. Well done to all of you. Okay, next question. This is an analysis question. It will be interesting. Neymar, the answer is there for you by Georgina. Neymar, the answer is there for you. Okay, what's your answer, ladies and gents? What's your answer? Give me your answer. Give me your answer. If you found it very difficult, like, gosh, what's going on there, Marvin? Type of zero. So I'm getting loads of A's. I'm getting 1 0. I'm getting A. I'm getting D. A. I'm getting D. E. I'm getting E's from Maria Faisal, Zainab E. Emma A. Okay, so we're getting a mixture. So here's what I'm going to show you guys. Let's look at the question. Let's use our formula. So disco, any drugs? You guys see any drugs? Yes, we can see some metoprolol in there. Okay, patients on metoprolol IV. Any issues this patient's got? The patient or conditions? The patient's got gout, diarrhea, palpitations. There is AF. Thank you very much, Mihal. Very, very important. What about the subject? The patient is a male. 36 years old. So here's the thing. The patient, your pharmacist on the ward and the GP is asking you what medication with the best option to reduce this patient's stroke risk. Now, right, we've got 36-year-old male, we've got atrial fibrillation, and all these drugs are anticoagulants. What do you need to do before you prescribe an anticoagulant to a patient with AF, precisely non-valvular AF? What do you need? Let's see. Chadvas, Orbiscore, Chadvas. So what score determines your risk of stroke? What do we use, ladies and gents? Bilal Ali says Chad. I've got Chadvas. Great stuff. So what I want to show you guys now is the difference between your recall and your analysis type questions. So many of you are able to recall, you use the Chadvas, but the challenge you have is applying that Chadvas to this question right now. Okay, so if you use the Chadvas, what is this patient's Chadvas score? Anyone know? Is anyone able to look at that and work out what this patient's Chadvas score is? Because this is part of your exam. What is this patient's Chadvas score? So I've got 1, I've got 0 from Sidra. I've got, what is Chadvas? Okay, we've got different years, so understandable. I've got 0, I've got 0. So looking at what you guys have worked out, majority of you have 0. So if the patient's got a Chadvas score of 0, what do we do? Do we give them anticoagulants, yes or no? No need, no. So the answer to this question is none of the above. None of the above. This patient in a hospital real life scenario doesn't require any of these anticoagulants. You only prescribe anticoagulants for patients with AF to prevent them when there's a risk of stroke. But you need to have a score. You need to have a score of at least 1 for guys or for men, right? And so at least 1 for men and at least 2 for women. So anyone that has a score of 2 and above, regardless of whether it's man or woman, they'll all need anticoagulants. In this situation, the Chadvas score is 0. We're going to look at that later on because I'm going to give you guys more questions. But the Chadvas score is 0. So in a real life situation, this patient does not need any form of anticoagulation. If he was older than 76 by Azizat, what would the answer be? Thank you, Azizat. We'll look at that later. So if this patient was older than 76, that's already 2. Okay, if that was a man, that's 2. So in that case, yes, he will need anticoagulants. Does that make sense? Does that make sense? Whoever asked that question, Azizat, yes, good question. If that patient was 76, anything above 75 is 2 points. That patient, if it's a man, will automatically have 2. If it was a female, she will automatically have 3. So in that case, yes, they will need one of these drugs. Okay, great stuff. Next question, are we ready? Are we ready? Give me 1, give me 1. Time is flying by. Give me 1. Okay, fantastic. How many of you are enjoying the session so far? Are we learning something today? If you are learning, type of me. Great stuff. I've got all of you covered. So let's go to the next question. Someone's asking previously, doesn't AF count? Sorry, I just have to go back for this. I know most people ask that question because the patient's got AF. No, it doesn't, because your AF doesn't count towards a point. It doesn't count towards the point. All right. The Chadvas is what counts. So you need to know what Chadvas stands for, which I'm going to test you guys later on. Okay, so what is this? And AF is not a vascular disease. I'm going to show exactly which ones are considered vascular diseases. AF increases the risk of stroke, but it is not one of the factors for your CHAD fast. So you only use for a patient that has got AF. You use the CHAD fast for only for patients with AF, right? Only with patients with AF. But AF itself is not a point. Okay, so what we got for this answer? So I'm getting different answers. I'm getting D's, I'm getting E's, I'm getting C's. Interesting. So let's use our formula. What formula do we use, ladies and gents? What formula do we use? What do we start off with to analyze the question? What do we use? DISCO. Thank you very much. So DISCO is what we start off with. Any drugs? Can you see any drugs? Give me one. What drugs is this patient taking and what does it tell you? So all GPhC questions, you're going to see exactly what I'm talking about. You're going to apply this critical thinking and you'll be so confident. So yes, so we could see salbutamol, we can see beclomethasone. What does this tell us? This tells us the patient is asthmatic. It is key. It's important to know that information. Highlight it. What about any issues? What issues does this patient have? The patient's got hypertension. What about the subject? Is there anything that stands out with the subject, with our S on DISCO? Pregnant, fantastic. The GP is going to test you a lot on pregnant ladies, pregnancy, breastfeeding, children, elderly. So pregnant, this patient is 25 weeks pregnant. That tells us something. What does this tell us? There are only certain medications that you can give to pregnant ladies. Okay, the only certain medications or antihypertensive drugs that are allowed for pregnant women. Okay, so next thing I'm going to look at now is there any other, can't see much of blood results or anything, so that's fine. So now we're going to use what next formula we're going to use. We've established our DISCO. What we're going to use next, ladies and gents, we're going to go through GPS. We're going to navigate our way through the answers. The way you navigate that is to use your GPS to navigate. So here's what we've got. According to your guidelines, G stands for guidelines. What does the guidelines say, ladies and gents? Only labetalol and nifedipine are licensed in pregnancy. What does your guidelines say, ladies and gents? What does it say? So according to your guidelines, labetalol, nifedipine, and metaldopa are the 3 licensed drugs for hypertension in pregnancy. Okay, this according to your guidelines, G, right? Labetalol, nifedipine, metaldopa. Now the second part is P. So we've got G for guidelines. Now we need to look at P, which is priority or the first. So what is the first line? So amongst these 3 drugs, your guidelines say there is a first line. Yes, the other 2 are unlicensed, that's correct. Labetalol, while metaldopa, nifedipine are unlicensed drugs. First line, thank you very much. Mia Faye, Vasilic in the house, handing labetalol, absolutely correct. So labetalol is the first line. But do we have a problem, ladies and gents? Do we have a problem? If you can spot a problem, give me yes, give me yes, give me yes, absolutely. Asthma. So we've got the first line. We will normally go for labetalol. However, this patient, remember DISCO. Let's not forget DISCO. It's what you need to answer questions. I'm giving you guys a secret sauce. Many people are on this webinar today. They're not going to be able to answer questions as good as you. Because once you have DISCO, you've highlighted the key things not to forget in the exam. So that's how you can pick up your asthma. Remember asthma. So you're not going to give them labetalol. You're going to give them the second option, prioritization. What is the second line? So the second line effectively is nifedipine. Nifedipine is the second line. So in this situation, the correct answer is going to be E. Does that make sense? Give me one, give me one, give me one. We've analyzed it. We've used DISCO. We've used GPS. We've looked at prioritization. And we've finally come down to the most effective answer, which is the safest option. S, GPS, safe. Nifedipine. Great stuff. How many are loving the session so far? If you're loving the session, type of me, type of me, type of me. Yes, ladies and gents, let's go next question, next question, next question. So I was asking, where does metaldopa fall in? Metaldopa is the last option. So if they cannot take labetalol, if there's a contraindication with nifedipine, maybe some heart failure or something, then they have methyl dopa. No answers yet, ladies and gents. No answers yet. Please, please, please. You are forgiven, Maria. You are forgiven. I'll put you back on the raffle, Maria. Okay, what's your answer, ladies and gents? Answers, answers, answers. Let's see what your answers. Wow, lots of answers, lots of B's, lots of B's, lots of B's. 1A, lots of B's. A, B, A, B, A, B, A, B, 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 B. So you know what? The answer is B. The correct answer is B. So I'm not going to dwell too much on this unless anyone wants me to. But the fact that all of you, almost all of you got that correct, I don't want to spend time because it tells me that you know the stuff. You can't be that good at guessing. So you probably know you've gone through. So the answer is B. So the dose normally is 5, but because this patient's got 2 of the ABCs of apixaban, someone's put age over 40, 60 kilograms, and 133 of your creatine 7 creatinine. Anything above that, if you have 2 of those factors out of the 3, then you need to reduce the dose. So the normal dose is 5 milligrams, and you reduce that to 2.5 simply because the patient has got 2 of the factors. The patient is older than 80, and the patient also it's lightweight, right? I think it's 57. My video is covering it, 57 kilograms. Okay, great. All good. Everyone good with that? Give me a 1 if you are. Give me a 1. Give me 1. Give me a 1. What's the B in ABC? The B is body weight. It's body weight. So any body weight that's less than 60. Okay? Any body weight that's less than 60 means that you have to probably halve the dose. So from 5 to 2.5. Great. Great stuff. I remember it's twice a day. It's twice a day. So in the case, age and creatine clearance, so don't mix up serum creatinine and creatine clearance. So serum creatinine is 98 micromoles per liter. Normally, if you have it above 133, then you have the dose. So 2 factors, it has to be 2 things out of your ABC. One of those is serum creatinine. If it's above 133, then those are one of the things that are required to reduce the dose. But creatine clearance is different. With this specific drug, apixaban, off my head, I can't remember, my brain is all foggy, but off my head with creatine clearance for apixaban is between 15 to 49. Between 15 to 49 DOACs. We'll have a whole discussion on DOACs, but we cannot do that today. We don't have enough time. If now, I tell all of you to be the masters of READ, right? R-E-A-D, READ, rivaroxaban, edoxaban, apixaban, dabigatran. But we cannot do this today. We cannot do this. So next question. Are we ready for next question? Type of next, type of next, type of next. Someone put 15 to 29. I don't think it's 15 to 29. I think that's rivaroxaban. I think 15 to 29 is rivaroxaban. Oh, actually, maybe not. Maybe 15 to 29. Maybe you're right. Apixaban, sorry. 15 to 29, not 49. 15 to 29. Yes, great stuff. Well done, well done, well done. So next question, let's go. 15 to 49, apixaban. Okay, next one, next question, let's go. So that's your answer there. That's a good table for yes. Someone was asking that question. Yes, rivaroxaban is from the combo course notes. 15 to 49 rivaroxaban, thank you very much. While apixaban is 15 to 29 for the creatine clearance, which is different from creatinine. Very important. Some notes from the course. Okay, next question. Another question where students struggle, referral questions. Let's see how you guys do. So your 1 minute starts now. Sidra Pavin was asking a previous question. Sidra, you need to have 2 factors and the patient has got 2 factors. The creatinine is not above, but the age of the patient is 85. So that's anything above 80. And then the other one was the body weight. The body weight was 57 and anything less than 60. Those are 2 factors. And those 2 factors then allow you to reduce the dose of apixaban. You're not dragging it, Sidra. Never say that. It's always a pleasure having you and supporting you the best I can. That's why we're here to support all of you. Okay, ladies and gents, what's the answer to this question? What are you guys going for? What are you guys going for? I'm getting A, I'm getting C, I'm getting A, I'm getting C, I'm getting A, I'm getting C, I'm getting C, C, A, or C, A, C, C, A, C. Wow. We literally have as many C's as we have as many A's. So this calls for us to dissect this question. What formula do we use, ladies and gents? What formula do we use? Type it down. DISCO, D-I-S-C-O. A-D-I-S-C-O. Okay, let's go. So let's look at the DISCO, right? So we're going to look at drugs, any drugs on there, ladies and gents. Not much. We're not going to use a lot of DISCO in this one because we don't really have all those things, okay? So, which makes it good. So look at DISCO, but drugs. What you're looking at is stroke. You've got the condition in there. You've got the patient. You can see the subject with the 59-year-old. I didn't say whether it's male or female, but it's a male. It's a male. Because I got his regular monthly medications. Okay, can someone remind me of DISCO, please? Alex, please tell me you only joined now. Because I've been going through DISCO. D is for drugs, right? I is for any issues. So things like the symptoms that they're complaining about, maybe diarrhea or something. That's what they're complaining about. That's what I is for. S is for the subject. So is it a male? Is it a female? Is she pregnant? Is it a child? Is it elderly? Okay, please learn this stuff. Please learn stuff. C is for condition. So do they have a condition? Is it a question on gout? Is it hypertension? Is it heart failure? Is it arrhythmia? And then O is for an other. Okay, other. So they could give you some extra things in the question. Look out for them, such as blood results. Okay, thank you, Mia Faye, for typing that down. So we are stuck, ladies and gents, between A and C, which is quite common in the exams. So we'll have to use our formulas to the best of our ability. So what is the right answer? Is it A, will you call 999 immediately, or will you try to sort this out? Give them aspirin immediately, and then you call 999. Thank you, Osa Riemann. Osa Riemann has given the reason why we're going to go for A. We cannot give the patient aspirin because we do not know what type of stroke they have. Okay, you do not give antiplatelets, anticoagulants to anyone that's having a hemorrhagic stroke. You don't. It's going to make it worse. You don't do that. You don't do that. So what you have to do, remember you're a pharmacist. This is happening in the pharmacy. The first thing you do is you dial 999 immediately. Unless you knew what type of stroke it was an ischemic stroke or a TIA, then you give them aspirin 300. But because you don't know what type, there's nothing that tells us the type of stroke. Remember, GPS, S is for safety. The safest option for this patient and for you to pass a safe pharmacist is to call 999. You do not refer him to the GP. Why wouldn't you refer this patient to the GP for treatment? Why wouldn't you refer this patient to the GP? Because it's urgent. Right, so you're not going to refer to GP for an emergency. Thank you very much. This comes up in the exam. And someone's asking, isn't outer place before aspirin for ischemic stroke? So you need to look into your guidelines. Yes, it is within 4.5 hours. Okay, but this is not what it's about. That happens only when they actually know what type of stroke it is. So you're going to give outer place if you knew it was an ischemic stroke, right? But in this case, the question is saying it was just a suspected stroke. We have to know what type of stroke it is before we give them medication. Is this clear? Give me one, give me one, give me one. If you're with me, give me one. If you're enjoying the session so far, we've been here for almost an hour. How many of you feel like the time is going by when you're having fun? Type of me, type of me, type of me, type of me. Fantastic. Okay, let's go. Next question, ladies and gents. By the way, do me a favor. If you're enjoying this session, if you're on social media, just put a post out there on social media. You're allowed to take a screenshot of my slide. Put a post and just say, wow, we're having a good session. Lovely. Share with the BPSA because this is great for them to organize such an amazing evening. Will you give outer place in community? As is that in community, you wouldn't. Okay, you wouldn't unless you're able to diagnose what type of stroke this patient is having, right? So in community, you will call the ambulance, right? If someone's having a stroke and you're a pharmacist, in your pharmacy, a patient's having a stroke, you also have to make sure it's within your scope of practice, right? So just think about yourself as a pharmacist. You're in your pharmacy and someone comes in and they're having a stroke. That's how you have to think about it. What do? You will have to call the ambulance. Artab is only given on that grade, fantastic, okay? So you don't do that. The best option and the safest option is to call the ambulance, and that will be done. They'll be able to sort out what type of stroke this patient has. They'll be able to give that patient out of place if it is not hemorrhagic. Okay, next question. We wait for next question. There we go, next question. So this question is more of a recall type question. You don't need a lot of analysis for this type of questions. So let's go. What's your answer, ladies and gentlemen? The BPSA members, the lovely bunch, the smart bunch, the special ones. What we got? These, A's, these, loads of these, 1 or 2 A's, loads of these, 1 or 2 A's, these. So the correct answer, ladies and gents, is D. Okay, it's D. Why is it D? Because we don't give them a diuretic. According to your guidelines, what do you give them? It's not just a diuretic. Thiazide-like diuretic, fantastic. Give me examples of your most common thiazide-like diuretics, because these ones affect your electrolytes less. Okay, so there's more of a balance with your thiazide-like diuretics compared to your thiazide, such as Benadryl. So indapamide, and what's the other one? There's 2-in-1 clothalidone. Thank you, Simran Ojla. Fantastic. Gian Abdallah. Great stuff. So let's go to the next question. So that's obviously used on the combo course. We use CAT and we use ACT, which are just ways to remember what to give. Okay, but it's thiazide-like diuretic, not thiazide diuretic. Okay, so you go for indapamide, not Benadryl 2.5. Okay, next question. Some calculations, you're not allowed a calculator on paper 2. So I want you guys to work this out and see if you can come up with an answer. So all of these questions I'm giving today are questions that have come up in the GPhC exam, not word for word, but around the same thing. So remember at the start, we spoke about the HAS formula. I'm giving you questions on HAS because I want you guys to get really, really good at HAS. I want you to get really, really good at analyzing critical thinking using GPS and DISCO, because I know that if I can get you that good using these formulas, you will walk into that exam and you will totally ace the exam. So take your time, look at this question, and I want you to give me your calculation. So, ladies and gents, what is your answer? Let's go. By the way, do not feel bad if this looks too fast for you or you feel like people are putting so many answers and you don't have time to catch up. It's simply because everyone is at a different stage. Okay, we have a mixture of years, so don't feel bad. I don't feel bad. I don't expect you to be as quick as a trainee pharmacist that's doing the exam in about 6 weeks' time compared to a first-year pharmacy student. All I do is appreciate all of you in here and well done for turning up. Okay, so what answer do we have? We've got A, we've got C, we've got E. BPSA, we have a problem. We've got a mixture of answers. It means we have a problem with our CHA2DS2-VASc. So what is the score? Let's see, what do we think? So here's what we do with the CHA2DS2-VASc score. What is the approximate risk of stroke for this patient? Let me just move this to the side a little bit so I can see what we've got. So we've got the patient is 75 years old. What was the score? 75 years old. What is the score? 2. Thank you very much. Patient is a woman, a lady. What is the score? 1. So 1, 3. We are on 3. Ladies and gents, we are on 3. Patient has hypertension. What's the score for hypertension? 1, we are on 4. Patient's got diabetes. What's the score for diabetes? Another 1, we are on 5, ladies and gents. And then the patient's got a history of a TIA. What's the score of a TIA? 2. What does that give us? 5 plus 2 gives us 7. So all of you that put 7, well done. This patient has a CHA2DS2-VASc score of 7. 7 is the correct answer. So before an exam, it could come up again. All right, so those of you that are not sure about the CHA2DS2-VASc score, here you go. Now, I'm going to show you this slide because there's a lovely gentleman that asked a question earlier and I was asking whether AF was included. or whether AF was a vascular disease. It's so important that you know what the vascular disease is according to the CHA2DS2-VASc risk factors. So these are your risk factors. There isn't any AF, right? So you need to learn them as they are, right? These are the risk factors with the scores. Vascular disease is a whole term, and if you are confused what this entails, you just have to go to the right. So vascular disease, we're looking at previous heart attack, peripheral arterial disease, or aortic plaque. All good? If it's all good, type of 1, type of 1, type of 1. Fantastic. So next question. This is another content question, okay? Recall question. RQ, it's a recall question. Doesn't need deep analysis like an analysis question, but you will get a mixture of both in your exam. Someone's asking, is that me? Yes. I just start making it a bit exciting. I didn't even ask you for the answers that you guys are going for. Okay, what's your answer, ladies and gents? What's the answer? What's the answer? Will this be available later somewhere? You have to ask the boss Emma, okay? Emma decides, Emma calls the shots in here. So you have to ask Emma after this, all right? From the BPSA, Lady Emma. All right, great stuff. So loads of D. So I see you guys know the stuff. So it is D. It is the nebivolol. Anyone stuck with this? Just use your mnemonic B-man, right? B-man. Is anyone that knows the mnemonics but gets confused which is which? Give me a yes if that's you. Like, oh Marvin, no, I know this mnemonics. I know be a man, but you know, Marvin, I'm still so confused. If that's you, type a yes. What does be a man stand for? Okay, I'll just show you guys something that I do. Makes life easy, like I always do. Oh, no, I'll show you the next question. Can I even type on here? Okay, I may not be able to type on here. I don't want to mess it up. But let me show you something. Who is confused with the mnemonics? Oh, Marvin, I don't really know what this is. Give me a yes if that's you. Always get confused with be a man and can't. Okay, let me help Maria Raza out because Maria says, Marvin, I always get confused between be a man and can't. Check this out, Maria. Today is your lucky day. Maria, I want you to type in the comments, lucky day. Type in lucky day, Maria. So when it comes to the exam, you will totally smash it. Lucky day. Fantastic. So here's what you do, Maria, right? So what does B normally stand for? There's normally one B. Do you know that part, Maria? Give me a yes. Maria Faisal. Do you know what B stands for? Yes. Okay. Bisopolar. So we're good, right? So this be a man. Be a man simply means a man has got heart, right? So these are cardio-selective ones, okay? Heart. Yeah, and always confuses me. It wouldn't confuse you right now. So check this out. Check this out. So B is always going to be B, bisopolar, so you're not going to be confused with that. You've got two A's. You've got two A's, and there are only two A's in all of these mnemonics. It's either A's-butolol or atenolol, okay? So there's nothing to get confused about this one because you're going to put both of them. You're going to have atenolol and you're going to have A's-butolol. You only have metoprolol, so nothing to get confused about. So what do you guys get confused about? I'll tell you what you get confused about. Can someone type in? Maria, type in what you get confused about. Which one do you get confused about? Nebivolol, right? Nebivolol. Nadolol. Thank you, Maria, because Maria Mahmoud, nebivolol and nadolol. Is that the same with you, Maria? Lots of Marias. Faisal. Is that the one you get confused with, whether it's nadolol or nebivolol? Please type a yes, type a yes, type a yes. Okay, this is what you need to do. Work in reverse. N-E-B, nebivolol, N-E-B. That's going to help you to know which one is nebivolol and which one is nadolol. Can you see that? Give me one, give me one. And if you always remember this stuff now, give me one. Fantastic. Do not get confused whether this is nadolol or this is nebivolol. Just do your reverse engineering. You're actually a reverse engineer from now on, Maria Faisal. Great stuff. So that's going to help you. That's going to help you. So next time when you see what I can't, then you can go, oh yeah, I know what this is now, right? So this is nebivolol. Okay, fantastic. So let's go to the next question. Soon Georgina, the lovely Georgina, will be coming on. What about this question? You need to know your interactions, come up in every exam. Let's try this one. Your 1 minute starts now, ladies and gents. So do me a favor, ladies and gents, take a screenshot and share it on your social media. Share it on Instagram, share it on LinkedIn, and just write you're having a great revision session organized by the BPSA. Tag me on this as well, at Marvin Munzo. Sherry, you're having a great session today with the BPSA. This is amazing. So what answer do you guys have? What did you guys go for? I'm getting B's and C's, loads of C's, 1 or 2 B's, loads of C's, loads of C's, loads of C's. So I'm not going to spend too much time to explain this answer because it is clear that most of you are getting this right. So the correct answer is C. Grapefruit juice is an inhibitor. It would increase the concentration of atorvastatin. Okay. It will increase the concentration of atorvastatin. So you need to know your inhibitors and you need to know your enzyme inducers. You always get questions in your exam on enzyme inhibitors and enzyme inducers. So next question. What about this question? We are back to the CHA2DS2-VASc score. Lovely Sia is asking, sorry, what was the answer to the previous question? The answer was C to the previous question. The answer was C. And C was grapefruit juice increases the concentration of atorvastatin. Is there an easy way to remember what enzyme induces? Yes, there is. Loads of easy ways. Mia Faye has put that down for you. Scrap GPs and sickfaces.com. These are the most common ones. Although you still need to add a few more drugs onto Scrap GPs just in case, because one of the exams you had to pyramid and it's not under Scrap GPs. So be careful. But yes, use Scrap GPs. Majority of the time, they're going to ask you on Scrap GPs or sickfaces.com. Okay, so what's the answer, ladies and gents? What's the answer to this question? I'm getting B, I'm getting A, I'm getting D. Interesting. B's, 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 D's, A. Wow, D's, A. So we need to do some calculation. Get a mixture of answers. All right, let's see who's correct. It's come up before in the exam. It may come up. Give me the answer. Okay. All right, all right. All right, let's do this. So let's look at the picture. Let's count together. Mrs. What does that tell you? What is the points? How many points? Mrs. J. Is it 1 or 2 points? Mrs. J. 1. Fantastic. That's a lady. 78 years old. How many points is that? 2. So we are on 3. She visited her GP recently to assess her risk of stroke. She suffers from atrial fibrillation. Remember that's 0 for atrial fibrillation. She also has other comorbidities. Hypercholesterolemia. What is that? Is it 1? Is it 0? I'm getting 0 and 1. So let's leave that for now. It's actually 0. Okay, so if you put 1 there, then try again. Type 2 diabetes. What is that? What's the score for that? 1. So we're now on 4. We're now on 4. Hypertension. 1. CHA2DS2-VASc. We're now on 5. Peripheral arterial disease. Remember, we had vascular disease. 6. So what is the correct answer, ladies and gentlemen? It is D6. So those of you that put D6, well done. Fantastic. Great stuff. Great stuff. How many of you are still enjoying the session? If you're still in the session, ladies and gents, type of me, type of me, type of me. Great stuff. Do you remember last time you had a university lecture that was more than an hour? How you're dozing off? I hope you're not dozing off in this lecture. Okay, next question. So please learn this. For those of you that are not really getting the CHA2DS2-VASc score correct, don't worry about it. All you have to do is just memorize this stuff. Okay, please memorize this stuff because it does come up in the exam and it may come up again. Can we get these slides if we are on the combo course? You know what? Yes. Yes, yes. Sia, Nam, yes. Yes, you can. You can. Okay, Miss X has recently suffered. I'll let you guys do this one. I'll let you do this one. Aziz is asking, do you do more like this? So we'll do these for all chapters of the BNF, 16 chapters of the BNF, all of them. But again, we can't cover the whole BNF in an hour. That would be ridiculous. So we have to take one. And maybe next time, we might do the endocrine, and then we'll be able to do, I'll do more sessions. Okay, ladies and gents, what's the answer to this question? What did you guys go for? So I'm getting C, 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 Fiona, C, E, C, C, D, C, D, C, C, Mia, Face, C, Rallister, C, D. Fantastic. So what is the correct answer? I think most of you are getting this correct, which is quite impressive. So most of you are getting correct. The answer is C. And why is it C? Is because it's secondary prevention. If it was primary prevention, what would be the answer? E. Fantastic. So primary prevention is E, and secondary prevention, because this patient has had a history, suffered an ischemic stroke, she's recovered, but you need something long-term. Because they've already had an episode, the long-term prevention will be secondary because they've had it before, okay? They've had an incident already. Okay, is this clear? Give me one, ladies and gents. I've got about 2 minutes and I'm going to get the lovely, the one and only, the lady, the amazing Georgina to do the OTC. So let's go one more question. What if they had TIA? Yes, it will still count. It will still count as a cardiovascular event. Hilary Chan, yes. Think about all your cardiovascular events, things like strokes, like MIs, anything to do with the heart and your blood vessels. If they've had that before, they're going to have secondary prevention, which is 80 milligrams atorvastatin. Can we please see the previous slide on TIA? So sorry, that was just an answer. That's from the combo course notes. These are my notes. These are the combo course. You have the slides, but Ali Khan, I tell you what, after I give this answer, I'm going to go back just for you, Ali Khan, so that you can see that slide. My famous slide, my class, just for Ali Khan. So what are your answers, ladies and gents? Let's have the answers. By the way, I'm very impressed with all of you. Like, you're all following the rules with 200 and something. That says a lot about all of you. Okay, so I've got a mixture. I've got C's and A's, mainly C's and A's. I've got loads of E, C, A, E. Wow. So interesting. I think we have to go through this one. I'm going to get a mixture of answers. So a lady, 78 years old lady. What are we going to use? What formula are we using, ladies and gents? What formula? So in this, actually, this question is more of a recall question. It may look like an analysis question, but it's more a recall question. So this patient admitted to A&E. She fell down the stairs. Oh, poor lady. I also go, poor lady. Oh my gosh, she fell down. Oh, I feel bad. Maybe I should change that question. I'm feeling emotional. It must be tough seeing a 78-year-old lady fall down the stairs. Her medical history shows she had an ischemic stroke recently and suffers from AF. She has a normal blood glucose level. So we're looking at, if we're going to use DISCO, this patient is 78. That's very important. She is 78. She's a lady. She's elderly. We'll look at any issue she's got. The doctor would like to manage the stroke long term. Okay. So this is what I want you guys to remember. There can only be one correct answer. Who thinks the answer is A? Who thinks the answer is B? Nobody. Oh, wow, it's got 1A. Okay, very good. I got 1B, very good. 2 B's, fantastic. Who thinks the answer is C? Oh, all of a sudden I got lots of C's. Fantastic. So the correct answer is C. Why is it C? because the patient has AF. Okay, so if you look at the management of stroke, you only use or mainly use antiplatelets, right? When I say antiplatelets, I'm referring to the main ones, which are aspirin, clopidogrel, dipyridamole. So this is for a normal patient with stroke, just stroke, right? Long-term management, you will tend to see antiplatelets. But here is the difference. If that patient has AF, which this patient clearly does, if they've got atrial fibrillation, if they've got and you need to manage the stroke, that's when you can give them an anticoagulant, or that's when you should give them an anticoagulant, only if it is a patient that's got AF and you're trying to prevent them having a stroke. Does that make sense? Type of 1, type of 1, type of 1. Hence the reason why we're not going to give them aspirin, we're not going to give them the dipyridamole, definitely not give them the digoxin, we're not going to give them aspirin, we're going to give them rivaroxaban. Why? Because it is preventing a stroke for a patient with AF. So ladies and gents, I'm going to stop there because I'm going to pass it on to the one and only, the legend, 100% in calculations, 98% in clinical, the genius, the boss lady, Georgina. Thank you, Georgina. Over to you.
Hello, everybody who is ready for some OTC. Give me a 2 if you are ready for some OTC. Amazing, amazing, amazing. Also, we got lots of 2s in the house, lots of 2s in the house. Okie dokie, so we're going to go through quite a few questions, guys, and it'll be the same rules of the game as you had with Marvin, okay? Okay, be the same rules of the game with OTC. So guys, how do you guys feel at the moment in terms of OTC revision? How do you guys feel on the scale of 1 to 10? Do you think, yes, it's good, not good? Ah, no. Okay, we're getting some not good, we're getting some 5s, we're getting some 2s, we're getting a mix. Could be better, could be better. Hopefully after today's session, we would have improved your confidence, okay? Hopefully we would improve your confidence, okay? So after each question, we're going to go through some bits. Hopefully you'll learn some bits along the way as well, okay? So guys, who is ready for a quiz? Who is ready for an OTC quiz? Yes, we're getting me's. I have had coffee, so I am more hyper than usual. Okay, how long is the session? So the session actually ends at 9 o'clock. Actually ends at 9 o'clock. Okie dokies. Let's get ready for our first question. Guys, you'll be timed 1 minute. Okay, after that 1 minute, then only put your answers down after that 1 minute. Same rules of the game as you did with Marvin with clinical. Okay, so Marvin, first question, pretty please. Here is your first question, guys. It'd be very common in the GPhC exam that you would get an OTC topic with a picture of a condition, and you would be expected to identify what the problem is. Oh, eager beaver in the house, eager beaver, please wait for your 1 minute. Okay, guys, what answers do we have in the house? Bees. Damn, you are telling me that this is subconjunctival hemorrhage. Fantastic, guys. Well done. The correct answer is subconjunctival hemorrhage, okay? You are all telling me it is B, but what is it? What is subconjunctival hemorrhage? What causes it? What causes it? Don't worry, we will go through the other options. We'll go through the other options as well. It is a burst blood vessel. Spot on. Yes, rupture of a blood vessel. Mia says burst blood vessel in the eye. Seizure blood vessel bursted. Fantastic. Well done. Okay, what causes the blood vessel to burst? Could be pressure. Yes, it could be due to it could potentially be due to the blood pressure is a little bit too high. It could potentially be due to an injury to the eye. Okay, but the most common reasons, okay, is either A, so it's gonna be spontaneous, it just happens bizarrely. Okay. And the other one is going to be coughing. If you cough too hard, fantastic. Michelle says coughing. Well done, well done. If you cough too hard, okay, it can cause a burst blood vessel. Okay, so is there any OTC treatment for this, guys? Is there any? No. Fantastic. It's self-limiting. It goes away within a period of 10 to 14 days. It doesn't cause any pain. It doesn't cause any discomfort. Okay, the only reason why you would refer, okay, only reason kind of by why you'd refer is going to be if the treatment duration is going to, well, not treatment duration, sorry, rewind. Okay. If there's going to be any pain in the eye, any visual disturbances, or if it hasn't cleared up after a period of 10 to 14 days. Okay. What's bloodshot eye for then? Okay, so bloodshot eyes, okay, is going to be used for a cosmetic use, but you cannot use those long term, because if you use those long term, it actually causes a rebound in the symptoms because it's a sympathomimetic eye drop. Okay, so it's actually the same way, you know, when you have your Sudafed nasal sprays, where it's going to be xylometallazine nasal sprays or oxymetallazine nasal sprays, the maximum treatment duration you can use it for, boom, Maria's even in there, I can't even finish off my sentence, well done, Maria, 7 days only, because you will get rebound congestion. Okay, similar thing with the sympathomimetic eye drops is that you can only use them short term, otherwise you are going to get a rebound in your symptoms. Keratitis, does anybody know what keratitis is? If you don't worry, I will teach you what keratitis is. Bilal says inflammation of cornea. Well done, fantastic. Okay, so keratitis, the exact definition or the exact meaning basically means inflammation of the cornea. It can occur as a result of a corneal ulcer, which can happen as a result of actually overusing your antibiotic eye drops, okay, or overusing steroid eye drops. Okay, some symptoms of keratitis, okay, you're going to have redness of the eye. Okay, so your eyes are going to be red, but the redness is going to be worse around the iris. It's going to be very, very distinct redness around the iris. Okay, lots of pain, photophobic. Yeah, you can potentially have a foreign body sensation, but the most common symptoms you'll have is very severe pain, very, very photophobic, okay, and you're going to have a decline in the visual acuity. Okay, so what do I mean by a decline in the visual acuity? Okay, so vision, it could be blurry vision. So you know when you have you don't go to the opticians and you've got those letters, okay, and you have to read down the letters. It basically means that you cannot read all the way down to the bottom. Okay, you can't read this far down. Okay. Okay, would it need referral? Of course it is going to need referral. It needs urgent referral, because if you don't treat it, the patient can actually lose their sight. Okay, guys, if you are ready for your next question, can you give me a 2? Give me a 2 if you are ready for your next question. Lots of 2s in the house. Fantastic. Let's get cracking. Okay, guys, what are your answers? What are your answers? Oh, this happens every single time. We also have a team A and we have a team C. Team A and team C. Okay. I can understand While some of you may think it could be allergic conjunctivitis, and therefore you would want to sell sodium chromoglycate 2% eye drops, okay? But is the patient having hay fever? No. I have told you in the question, the patient, yes, well done, Mark, he has got a cold. Valerie, well done, he has got a cold. Michelle, well done. It is viral conjunctivitis because the patient has a cold. Spot on, okay? Spot on, guys, spot on, okay? Viral conjunctivitis always comes along, not always, but if you do have viral conjunctivitis, it will always come along with a common cold or the flu, okay? So this patient has, yes, Mariam says A. The answer, the correct answer here, guys, is going to be A. It is viral conjunctivitis. There is no over-the-counter treatment available for viral conjunctivitis, okay? It is very, very contagious. Okay, so I think I've got my next slide. I think it's a table to basically a nice revision table for you guys to go through then different types of conjunctivitis. Boom, here it is. Okay, this is how I like my revision to be done. Okay, so let's go through the different types of conjunctivitis, okay, because not only is this important for the GPhC exam, you're going to need to know it in your clinical practice as well. Bacterial conjunctivitis, okay, it can affect one eye, but it can affect both eyes, particularly if you rub one eye and then rub the other eye, okay. It is a pussy eyeball, okay. Pussy eyeballs, that's what bacterial conjunctivitis is. It is very purulent, okay? Your eyes can feel a bit itchy, you can have a gritty sensation, you're going to have generalized kind of like redness, often lasts about 2 to 3 days, okay? But it can actually go away on its own. Up to 65% of cases of bacterial conjunctivitis can actually go away on their own, okay? And there's no other associated symptoms, okay? We've already established with viral conjunctivitis, it's going to affect both eyes simultaneously. Okay, you're going to have watery eyes, watery discharge, you're going to have itchy, gritty sensation in the eyes, okay, and it's going to come along with cold and flu symptoms, okay. Allergic conjunctivitis, both eyes are also going to be affected simultaneously, okay. Watering of the eyes, that watery discharge, that itchy, gritty sensation in the eyes, okay. How long it's actually going to last for is going to vary. Patients can actually have allergic conjunctivitis throughout the whole spring and summer season. It depends on the allergen exposure, okay? Some people can really suffer badly with allergic conjunctivitis, okay? And it's going, of course, it's going to be associated with hay fever or allergic rhinitis symptoms, okay? Because remember, there's two main different types of allergic rhinitis. You have acute, okay, which is going to be your hay fever, but also you can have allergic rhinitis that can last all year long as well, particularly those patients are going to be affected by dust mites. So guys, there's some quick revision questions here for you. What is the treatment for bacterial conjunctivitis? What is the treatment for bacterial conjunctivitis? Chloramphenicol, spot on. We have our 0.5% eye drops, which are Frigi eye drops, which are gold dust. Good luck having them in your pharmacy. Good luck. Yeah, 2 years plus. Well done. Yeah, you're going to use them for 5 days in total. Also, yeah, that's what I'm saying. Good luck. Good luck. This gold dust. It's like, you know, it's like Willy Wonka and the gold. Is it Willy Wonka and the Chocolate Factory when you have the golden ticket? It's like the chloramphenicol. Whee! I've got some chloramphenicol. Okay. Oh, okay. So you only have the ointment. Oh, I'm so jealous. I can't even get the ointment. Wow, you've got half a golden ticket, Bilal. Okay. Sandeep, you have some. Oh, that's it. You've won the lottery. You're going to be rich. Okay. So the treatment for allergic conjunctivitis, guys. What is the treatment for allergic conjunctivitis? Sodium chromoglycate. Spot on. Well done, well done. Okay, and what are some of your red flag symptoms for eye conditions? What are some of your red flags? If someone came into the pharmacy with an eye problem and they gave you, I don't know, XYZ symptom, you go, ugh, yeah, I can't help you there. We got to refer you. Photophobia, pain. Reduced visual acuity, spot on. Visual disturbances, photophobia. Contact lenses. Oh, what makes you say about contact lenses? Contact lenses can cause all sorts of problems. Contact lenses can actually cause keratitis. if you reuse your contact lenses and don't replace them. Visual disturbances, fantastic, fantastic. Next slide, please, Marvin. We are going to go through our red flag symptoms, okay? One easy way to remember this is going to be vapor, okay? V is going to be vision is going to be affected, whether it's a change in the color of the vision, whether it's a decline in the visual acuity, okay? Associated symptoms, nausea, vomiting, headache. Why is this important? Why are these symptoms important? Increase intraocular pressure. Well done, Sidra. Well done, well done. Okay, so acute angle closure glaucoma. Okay, patients can have nausea, vomiting, and headache. Okay, they can have nausea, vomiting, and headache. Okay, by having that such a rapid rise in the increase in that intraocular pressure. They will also tell you that they can have halos around their vision, they're having a lot of pain. The pain is going to be absolutely excruciating. Okay, very, very, very severe pain. Okay, sometimes their eye can actually look quite cloudy as well. Okay, as a result of having this massive, massive raise in intraocular pressure. Okay, and often kind of like students ask me what actually causes, okay, what actually causes the glaucoma to start, the acute angle closure glaucoma. Okay, what happens is the iris can bulge and it actually blocks the aqueous humor. Okay, the aqueous humor kind of like draining out of the eye instead. Okay, so basically you get a build up of all of this kind of like liquid. Okay, so photophobia and pain is going to be another one. OTC treatment failure. If someone comes in and they have actually got a pussy eyeball and you've already sold them kind of like that golden ticket chloramphenicol eye drops, okay, and it still hasn't improving, you're going to refer, okay. Or if they have other eye conditions, if a patient has keratitis, uveitis, you're going to want to refer them, okay. Under 2 for chloramphenicol eye drops, that's really important, okay. And if the patient's going to be having recurrent problems with their eyes, you know, ideally that should be dealt with as a specialist. Okay, so if that's clear, guys, can you give me a 2? Give me a 2. Spot on. Well, fantastic, fantastic. Are you guys learning something with OTC today? Can you give me a yes if you are learning something? Yes, 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 yes. Fantastic. Let's get on to our next question. Also, another important thing for the GPhC exam, not only would you be expected to identify conditions from a picture, but you need to know when to refer to a GP, hospital, etc., etc. Okay, guys, what answers do we have in the house? We've got A's, 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 A's. Oh, we've got a cheeky E in there, okay? It's all A's, 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 A's. Fantastic, okay? The correct answer is A, dysphagia, but what is it, okay? I am giving you this fancy medical term, but what is it? What does it mean? True difficulty in swallowing. Fantastic, fantastic. Well done, fantastic. Okie dokies. Yes, well done. So dysphagia is the correct answer. Okay, and what also we're going to go through, guys, we're going to go through some red flag symptoms. So guys, what are your red flag symptoms for dyspepsia? Okay, so we've got over 55, unexplained weight loss. Alarm! Yes, we've got some alarms. We've got alarm, 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 alarm. Alarm, fantastic. Okay, anemia, anemia. Vomiting blood, yes, well done. Okay, fantastic. Let's go through these red flag symptoms. Let's go through these. Okay, next slide, please, Marvin. Pretty please, boss man. And the next one again. Fantastic. Alarm, 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 alarm. Okay, here are your red flag referrals for dyspepsia. Okay, alarm. Okay, alarm stands for anemia, loss of weight, anorexia, recent onset progressive symptoms, particularly if they're over the age of 55 years. Okay, and bulimia. What is that? What is that? Yeah, black poo. It's black poo. Yeah, blood in the poo. Fantastic, fantastic. Okay, but of course, alarm is also going to include dysphagia, which you've already covered, guys, in terms of true difficulty in swallowing. Hematemesis, what is that? Hematemesis, what is that? Vomiting blood, vomiting blood. What does that tell you, guys? If someone has hematemesis, what are we concerned about? Ulcers, yes, they have a stomach bleed, off to the hospital they go. Okay, being over the age of 55 and having a recent onset progressive symptoms, this could be a potential, well, it can be, but you're going to be quite concerned about potential GI cancer risk. So that's why we refer those patients. Okay, but if someone actually has, let's say, for example, it was me, okay, or like if you know in the OTC course, I used the famous Mr. Gohill a lot as one of the examples, okay. So if, like, let's say for example myself and Mr. Gohill had either anemia, weight loss, anorexia, etc., dysphagia, you're going to refer those patients to. Okay, so let's hope that makes sense for you guys. Okay, so are you all feeling happier about red flag referrals for dyspepsia? If you are, can you give me a 2 so we can move on to our next question, guys? We'll move on to our next question. Fantastic, fantastic. Boom, 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 boom. Okay, here is your next question, guys. Okay, guys, what is the answers, guys? What's the answer? We've got lots of A's in the house. Lots of A's, lots of A's. Well done, well done. The correct answer is oropharyngeal candidias. Okay. No clue what BPSA is. Don't worry, we're going to go through it. Okay. Lichen planus. Okay, so let's make it first of all absolutely clear. The correct answer here is A, guys. Okay. Correct answer here is A. The patient has oral thrush. Okay. So B, okay, lichen planus is actually a skin condition, okay, it can cause skin rash. Most commonly can affect the wrists, okay, but it can also have oral mucosal involvement, okay. If I said to you that lichen planus can actually cause white spiderweb lesions in the mouth, would you believe me? Or would you think, nah, you're talking rubbish? Who thinks I'm talking rubbish? Give me a 1 if you think I'm talking rubbish. No, so if you actually go on Google Images, okay, after this session, Google lichen planus, okay, Google lichen planus mouth, okay, it can cause white spiderweb lesions in the mouth. Yep, so lichen planus can only affect the skin sometimes, okay, but some patients can either have it affecting the skin, okay, or it can affect the skin and mouth. Okay, So if you don't believe me and you think I am lying, Google it, okay? Put it on Google Images. It can cause white spiderweb lesions in the mouth, okay? Leukoplakia. Leukoplakia is a thick, checks it, looks horrid. I know, it looks horrible, doesn't it? I hope he wasn't eating your dinner while she was looking at that. Oh my God, it's true. I told you, Mariam, I wasn't lying. Would I ever lie to you? Would I ever lie to you? Okay, leukoplakia. Okay, so leukoplakia, it's a thick white patch on the tongue. It's often a growth kind of like on the tongue. It can affect the side of the mouth, inside of the mouth, or on the tongue, for example. It can be a sign of a pre-malignant lesion, a pre-cancerous lesion. Okay, it can happen. It's more likely to happen in people who smoke. Yeah, and it can also happen in patients who are immunocompromised. Yeah, fantastic. Okay, herpetiform ulcers. Who knows what herpetiform ulcers are? How do they differ from a normal mouth ulcer? Yeah, so basically herpetiform ulcers are going to be small pinpoint ulcers that occur in the posterior part of the mouth, okay, and they occur in crops of 100 at a time. Okay, we'll get on to that, Maria, in a second. That's going on to our next question. So guys, if you're ready for your next question, can you give me a 1? If you are happy with this question, happy with other conditions, give me a 1. Fantastic. Okay, let's get cracking on to our next question. Oh no, I thought I put it in. Never mind. Do this question and I'll answer the nystatin question in a second. Whilst you guys are reading through that, okay, I thought I'd put another question about treatment of oral thrush, but I think I left it out, okay, but not to worry. So because the patient is on warfarin in the previous question, you cannot sell miconazole. It will significantly raise the INR and you'll be risking the patient having a major bleed. You would need to refer the patient to have nystatin, okay? That'll be the treatment they would need, is nystatin for the treatment of oral thrush in patients who are taking warfarin. Okay, guys, do we have an answer for this question? We're getting some D's, we're getting some E's, we're getting some D's, we're getting some E's. Oh, Team E and Team D. Team E, fantastic. Okay. Okay, let's go through this, guys. Okay, so yes, red flag, flank pain, elderly. How long has this patient actually had this for? How long have they had symptoms for? 7 days, okay? At what point do you think, oh my God, this is a bad infection? Now. Yeah, fantastic. Okay. So yes, elderly, okay? We've got elderly, okay? They're experiencing, they've been having dysuria for the past 7 days. Symptoms have worsened, okay? They haven't got any better, okay? Cystitis, simple cystitis would usually go away after 2 days, okay? They're experiencing flank pain and fever. So what is wrong with this patient? What is wrong with pyelonephritis? Yes. Well done. We got pyelonephritis. Yes. Fever. Check for sepsis. Fantastic. Your new score. Okay. New score. That's really important in community. Okay. It's very, very easy for patients to become septic. Yeah, upper UTI, spot on. Okay, so if we consider that this patient has potentially pyelonephritis, are we going to sell them any sodium citrate sachets or potassium citrate sachets? Nope. You're telling me to get lost and this patient needs to... Long gone for that, fair enough. You're telling me to get lost and this patient needs antibiotics. Fantastic. So the correct answer here is going to be E, guys. We need to urgently refer this patient for antibiotic treatment for the UTI. Yeah, so in terms of, yes, you can give cefalexin. You can give cefalexin. Okay, so everybody, are we all okay with this question? Would you tell them to withhold Referral due to sick day rules? Yes, you can do. If they're very unwell, you can do that. Fantastic. Who is ready for the, actually, before we move on to the next question, I'm getting ahead of myself, guys. I'm getting ahead of myself. On the next slide, I have actually got you a little mnemonic for you about referrals for UTIs in the community. So, guys, can you name me some red flag referrals in the community for UTIs? Yeah, we've got bleeding, blood, elderly, male, UTI, fantastic. Okay, because I have got a fantastic acronym for you. I've got a fantastic acronym for you. Pregnant, fantastic. Okay, fantastic. If we go on to the next slide, we'll be able to see this mnemonic, guys. Okay, locums pub. Okay. Locums pub. If you're thinking about locums pub, we are not thinking about locum pharmacists who cannot be bothered to turn up to their shift, okay, in the pharmacy. We are talking about red flag referrals for UTIs, okay? So, patients with loin pain, okay? Loin pain, that's going to indicate potential pyelonephritis. We've already established that in the question. OTC treatment failure, or they're having recurrent attacks, okay? Patients who keep on having UTIs, they may need either a low dose nitrofurantoin towing to prevent infection, okay? Under 16, children under 16, we refer. Systemically unwell, so if they're unwell systemically, we need to refer, okay? Men, okay? Men, okay, we need to refer men and we need to refer children, okay? So, men don't actually get, they're not meant to, well, women get more UTIs, okay, and it's more common for women to get UTIs because we have a shorter urethra in comparison to men, so it's very easy for the E. coli to travel up our urethra and actually get to our bladder, okay? With men, the urethra is much longer, okay, so obviously the E. coli has a little bit more traveling to do, okay, and also men also have a prostate as well, okay? If symptoms are going to be lasting more than 2 days, we need to refer them. And then also if women are going to be having vaginal discharge as well as UTI symptoms, this could be a potential sign for atrophic vaginitis. So we need to refer that patient just to get that confirmation, that diagnosis confirmed, okay? Pregnancy, okay, UTIs can actually cause complications in pregnancy, okay, so that's why if you are pregnant, okay, the midwife will be running around after you asking for your pee every 2 seconds to dip your urine, okay. UTI risk is going to be higher in diabetic immunocompromised, so you want to refer them, okay, and blood in urine, okay, blood in urine, that is really important, okay. If patients have that, we need to refer them, okay? So guys, who is ready for our next question? Can you give me a free? Fantastic, 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 fantastic. Okay, I just want to answer a quick question here, guys, before I time you for this. I had a patient who was male who seems to experience UTI symptoms. I say I need to refer, but they also would like to try OTC product. Would that still be okay? No. Nope. Okay, males, you would just need to refer. Okay. So guys, fantastic. We've got lots of frees in the house. Let's get started on our question. Fantastic. We are running short of time, so I'm going to time you about 30 seconds for each of these questions and hope that we can get these finished, okay? Fantastic. Okay, we're getting lots of D's, lots of D's, lots and lots of D's. Fantastic. Well done, guys. The correct answer here is molluscum contagiosum. Fantastic. Of course, it's going to be caused by the molluscum contagiosum virus. It can take quite a long time for it to clear. Okay, it's going to be 2 to 18 months. There isn't actually much treatment that you can actually give to a child. Okay. Not much treatment at all that you can give to a child. Sometimes the spots can be itchy. You may want to give an antihistamine if that's actually going to be helpful. Okay, fantastic, guys. Are we ready to move on to our next question? You've all got the question correct, so I'm assuming you all know your childhood conditions perfectly fine. Okay, if you are ready for your next question, give me a 2. Give me a 2, guys. Give me a 2. Fantastic. Let's move on to the next question. This is the last question of the night, guys. Oh, we're getting lots of D. Oh, Nicole saying granulocytosis. Well done. Lots of D's. Lots of D's. Well done. We're getting more D's in the house. More D, 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 D. More D, more D. Fantastic. Okay. Well done, guys. Well done, guys. Okay. So, adverse drug reaction, spot on. So we have a patient who's in the pharmacy, they're having sulfasalazine and they have budesonide for ulcerative colitis. They have a sore throat. Okay, well spotted. It's an adverse drug reaction. Okay, it's an adverse drug reaction. It is agranulocytosis. Okay, so well done, guys. Okay, it's really important for you to know in terms of which drugs actually cause agranulocytosis. Okay, which drugs actually cause a medicine-induced sore throat. Okay, so on the next slide, I've got a nice slides for you. Okay, medicine-induced sore throat. What you need to remember. Okay, the 4 C's, but don't forget about sulfur. Okay, the 4 C's and don't forget about sulfur. Okay, the 4 C's are going to be clozapine, cytotoxics, carbimazole, captopril, and sulfur-containing medicines, because let's not forget about sulfur-containing medicines. Okay, so of course, in this question was sulfasalazine. That includes sulfur. That causes medicine-induced sore throat. So, guys, I hope you've enjoyed the OTC, but don't go anywhere. Don't go anywhere, because the amazing Marvin is going to go for exam tips and Referral. Methotrexate is a cytotoxic. What's the difference between chickenpox and molluscum contagiosum, please? Okay, so chickenpox, they are fluid-filled blisters and they cross over. Whilst molluscum contagiosum is small, firm, raised spots with yellow or white head. Okay, so if you are ready for some exam tips with Marvin, who is ready? Who is ready for that? Yes, we've got lots of me's, lots of me's. I'll hand over to you, Marvin.
Great stuff, ladies and gents. We're back again. About 5 more minutes left, and we're going to end the session. I'm just going to give you guys quick tips to help you pass your exam or pass your registration exam, whatever exam you're doing, either at university or if you're doing that, the GPhC registration exam. So thank you, Georgina. I hope you enjoyed that session with the lovely Georgina. Give me a 1, give me a 1, give me a 1. So we're coming to the end of the session where I give you tips, and most importantly, I'm going to pick 2 amazing winners that are going to join our fantastic course or training program. So here we go, exam tips. How many of you guys are ready for the first tip? Type 1, type of 1, type of 1, type of 1, type of 1. So tip number 1 to help you with your exam is number 1, believe in yourself. Believe in yourself. Because think about you've been through a journey, you've passed exams in the first year university, your second year, your third year, your fourth year, your final year, and now you're obviously here now, and your tutor wouldn't put you forward to do this exam if you do not have what it takes to actually pass the exam, okay? So believe in yourself. That's the first tip I'm going to give you today. Believe in yourself. The second type of 2, if you're ready for the second one, type of 2, type of 2, type of 2. So the second thing is revise with friends or with a friend. Don't do it on your own. How many of you remember at university when you passed an exam or you got a question right simply because you were studying with a friend the night before? Maybe they showed you something or they explained something to you, and that thing came up in exam, type of me, type of me, type of me, type of me, type of me. So do not underestimate the power of studying together. Get a group, a WhatsApp group or a Telegram group, but do not do this on your own. So type of 3, if you're ready for the third tip, we have only 5 tips today. The third tip, tip number 3 is practice, 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 practice past papers. Do those more questions, do those past papers. Again, how many of you passed exams because you went to a number of past papers and you saw those similar questions in the exam? Give me a me, give me a me, give me a me. So the registration exam isn't any different. Over the past years, we've seen questions come up again that have come up previously, even if it wasn't word for word, but very, very similar questions. For instance, your IV drugs, your orders drugs, right? Your Nurofen, ibuprofen doses, and the rivaroxaban doses. So we normally get the same type of questions coming up. So please go through the questions and be ready to see some of them again. Where can we get these past papers? Most of them are in orders groups. You have like drop boxes. If you're in any training pharmacy group, they'll be sharing all these things. If you're in the Pre Reg Shortcuts group, then you have that in the Telegram group. Okay, waka all hack. Okay, number 4, type of 4, if you're ready for the fourth tip. Number 4, fantastic. Stick to a revision plan. Failing to plan is indeed planning to fail. The only way you're going to survive this exam is having a solid, a robust plan, being disciplined enough to stick to it. How many of you have taken a few days off before the exam? How many of you have taken off, maybe write down, have you taken off 1 day, a week, 2 weeks, 3 weeks? How much have you taken off before your exam for those of you actually writing an exam? So you need at least 2 weeks, right? 7 days is fine, but I encourage you to take at least 2 weeks before the exam. Okay, the last one, type of 5, you're ready for the final tip of the evening. Thank you so much. Tip number 5 is look after yourself. You are the most important person. You are the most important person. So make sure you get enough sleep, eat properly, hydrate yourself, exercise, reward yourself, take some time of revision from time to time, watch Netflix, and enjoy yourself, okay? So these are very important 5 tips that I need you guys to apply. And so now we're going to do the raffle so that 2 of you are going to win today. But before we do the raffle, ladies and gents, I just want to say thank you all so much for being such an amazing, amazing, amazing group. Thank you for all your support. Thank you for all your interaction. We hope you enjoy this session. Thank you to the lovely Georgina. Thank you to the amazing, amazing Emma for bringing us on here. I hope you guys learned a lot, and we do sincerely hope that some of this information will help you pass your exams, pass the final year exams, and absolutely become amazing pharmacists. Okay, so are we ready? If you're feeling lucky tonight, type a lucky, type a lucky, 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 lucky. Remember the mnemonics. What mnemonics have you learned today? Type the mnemonics down. What mnemonics are you taking home with you today? Disco, GPS, great stuff. Okay, let's do this. I've got 2 lucky winners. It's been very difficult to choose 2 out of 200 and something. And in all honesty, all of you have been very interactive. So everyone is a winner here today. But we only have 2. So I've had to choose 2 people that found them really interactive. But to be honest, all of you have been awesome. So the first winner today that's going to join the raffle, that's going to be able to get this free, amazing, amazing award to join the foundation program by Pre Reg Shortcuts is no other than Hanin Al-Hassimi. Is Hanin Al-Hassimi in the house? Type of me. Hanin Al-Hassimi. Yes, great stuff. So Hanin, Hasimi, you're the first winner. Please, what you will have to do is send an email to this email, info@preregshortcuts.com, and mention that you just won the BPSA raffle. Okay, Hanin, type of yes, that's okay, info@preregshortcuts.com, and mention to them, and they're going to enroll you in the course. The second person, the second place goes to no other than the one and only Sidra Tassier. Is Sidra in the house? Sidra, if you're in the house, please type of me, Sidra, if you're in there. Fantastic, Sidra. You want a place, please email info@preregshortcuts.com. We'll have to round this up by giving one more place to someone that has supported us, that has been here, that's organized this event, that has been outstanding, and that's going to go to lovely Emma. This is a separate, this is not part of the raffle, but this is just a separate raffle for all your hard work, for supporting us, for being there. So Emma, you will be joining, and we will be sharing you all access to our combo course to enable you to absolutely smash that exam. And to everyone else, thank you all so much. Please stay positive. You will all do well. And it's been a pleasure and an honor to have all of you tonight. Thank you all so much. Thank you, Georgina. Any final words from you?
Thank you, everyone, for joining tonight. Thank you, everybody. And if you're sitting your exam in June, good luck. You will smash it. You will be absolutely okay. If you're sitting your university exams, good luck, good luck. Good luck. You will be absolutely fine. You have gotten this far. You will absolutely smash it. Okay. You will be absolutely a-okay.
Brilliant. Others have done it. You can do it too. Okay. So Marvin, with those on the combo course session on all the mnemonics, remember. Yes. So all those in the combo course session, I'm going to put all these slides together and I'm going to send this to you. Emma's put a link out there for event feedback. Please make sure you drop some feedback about the events. You've got the BPSA link tree. Fantastic stuff. So take care, everyone. Thank you, Emma. Any last words from you, the lovely Emma, before we disappear?
Thank you, everyone, for attending, Marvin and Georgina. It's been brilliant having you as always. And thank you for gifting me the combo course as well. That will come in handy, I promise. But yeah, it's just been amazing. And I've already learned so much just for those 2 hours having in here. It's just every time I see you guys, the energy is just amazing. Thank you, guys, and thanks for everyone joining. And we'll have more events together. BPSA and Pre Reg Shortcuts.
Absolutely. Yeah. Absolutely. Thank you all so much. Watch us on YouTube if you want more videos. And thank you so much. Thank you, Emma. All the best. Thank you, BPSA. You are the best. We'll always support you. Take care, everyone, and we look forward to seeing you all soon.